And good morning, LinkedIn, or good afternoon, or good evening, depending on when you watch the video today. Welcome to the first of a new series in a new time for the Healthcare Thought Leadership LinkedIn Live Show. I'm Marion Spears Carr. I am recently the founder and managing partner of a new executive search, leadership solutions, and business consulting company called Inflow Executives. And this is my LinkedIn Live show. This normally on Fridays, but we're doing a special launch on Thursday. This is our first show of the new season. And I'm really very, very excited to be talking about this topic of putting the patient in the driver's seat, lower cost, improving care. And my guest is Myranda Cleary. And Myranda, you and I connected online, and I'll tell a little bit about your background. You also are a founder of a new company and managing director of a company called NuLight Consulting. And it's an organization focused on lowering healthcare costs for employees and their employers and their employees. And I'd love for you to introduce yourself. And thank you so much for being on Healthcare Thought Leadership LinkedIn
Yeah,
Live.
thank you so much for having me. Like Marion said, I'm Myranda Cleary. I'm the founder and managing director of NuLight Consulting. I just started this business really to address the problems within healthcare. And I've worked in various aspects in the industry on the provider side, on the payer side, and really just understanding that there is such a breakdown between how we can actually deliver high quality care. And I really started, just thinking, what does this look like? What does this business look like? And I actually found myself, figuring out, well, how do we pay for care, and talking through that piece of it, and realizing that there's so much money to go around. Why don't we kind of remove the barriers, remove the complexities that are existing within the healthcare space, and actually get to the patient who's at the end of it, who is the receiver of the care. They're the receiver of the bills. They're receiving all of these things on the back end, and typically it's not a great experience. People don't educate them on the healthcare system unless they honestly have an experience that's negative. And that's what we're finding is really the heart of what we need to do as an organization, is figure out how to put the patient first, put them above anything else, and really get back to saying, if we put them first and we are motivating them and incentivizing them, we can actually see the outcomes that we desire, rather than incentivizing providers and payers, is what we're doing right now in the value-based care models, really transitioning that back to the patient and saying, okay, what motivates them, what really is going to get them to make better decisions, and then seeing the outcomes are really just going to fall in line, and lowering costs as a result.
Absolutely. And the reason you and I connect is because of the interest that I have in the work that I do in the value-based care space, working
Hmm.
with companies that are building platforms, providing structure to leverage data, also working with fa- companies that are delivering that level of care. And just so excited to have you on your show. If you're watching live, or if you watch the recording, please post in the comments and let us know that you're there. We want to know that you're watching. We'd love to connect with you. So please, and for those of you who are watching this show for the very first time, I started Healthcare Thought Leadership, this LinkedIn Live show, almost 2 years ago, and I was sharing with Myranda on offline. I realized today, like, we're at like episode 70 plus now. I've lost track. So glad to have you on the conversation with me and starting the new season. Myranda, one of the things I wanted to talk about was what has been the barriers to patients having some control. You talked a little bit about in your introduction about not understanding the
Hmm.
system, not being able to understand where to go, what their bill really consists of, how to connect. Talk a little bit about kind of what have been up to this point the barriers for patients having that control, and tell us a little bit about some of the things that you're trying to help companies do to change that.
Sure. So, from a consumer or a patient standpoint, like I said, really your experience with the healthcare system is when you are faced with an unexpected chronic illness or something that is impacting your life in a maybe an unexpected way, and then you're forced to learn about the system. And I have not yet met somebody who said, I have had this experience and it was the best experience of my life. Maybe I will meet one day, but that is just not, the norm. And so really I think it's a matter of education. So one of the things that we're doing as an organization is providing resources, not just for our clients but for anyone who is interested in learning about care. The TikTok and the Instagram movements of providing content at short video clips is really what we are doing in terms of providing this really complex topic into bite-sized chunks of information so that people start to understand, oh, okay, so this is what my health insurance plan looks like. Oh, okay, this is how I navigate the care system. And getting that information up front and having those tools available to them is something that doesn't really exist today unless you work with a health plan and they provide those types of resources for you. But just the everyday consumer is not getting that information. And if they are getting information, that is great. But we just want to provide a platform for them to come and see, how do I become more educated in just the healthcare system in general? What does health insurance look like? Because what we're finding is a lot of people just have a big disconnect. And even the plans that they're participating in now with their employers, they're like, I don't know anything about it. I just know I'm covered if I go to the doctor and there's a problem. So we really want to equip people and empower them to have the information at their fingertips so that they can make better decisions about their care. Um, and so that's, one of the main things that we're doing. But from the employer standpoint, we do want to focus really on the consumer side because I think that really leads itself into the employer side. But as far as the employer, we're really just helping them, partnering them, helping them understand that there are other alternative models out there that they can participate in to lower their costs. So, one of the main things that I keep hearing and seeing everywhere is just, people are not able to afford the health insurance plans that they're in, from the employer side and from the employee side. So, really educating them and helping them understand those alternative models that they can participate in for their health insurance. Also providing that comprehensive coverage that people are wanting, but really transitioning to a model that really helps them and benefits them as the employer is what we're trying to do on that side.
That's outstanding. And I can attest for the fact that I've been with companies, also with my own companies, provide insurance for my team, myself, and have been employed as well. I often have no clue really what my cover. I just select the box and like, oh, maybe that's the coverage I need. Maybe it's not the coverage I need. I'm fairly healthy, so I don't go to the doctor very often. And to your point, when we have a catastrophic illness or we are sick or whatever, those are really, really incredible times. That's when, and we're at a straight state of risk, right? We're really we're at risk. We're in stress. That's not the time to be educated. That's not the time to learn what our coverage is, because then it's a shock. Checking in, by the way, thank you for those who watch live and our regular viewers and new viewers. Let us know. We'd love to know you're watching. Doug Luckett checking in from South Carolina. He has a question we're going to bring up in a second. Also, Gina Tipton checking in from Atlanta. Doug is in South Carolina. Both Gina and Doug are hospital executives and work in a variety of spaces, that kind of thing. I love this question that Doug brought up. I'm going to bring it to the screen. On the consumer side, will you be breaking down plans of all payers offering so the consumer can be educated on the nuances, insurance plans, on the nuances of what they are signed up for? I think you're leading to that question, but tell us about how you do that. How do we know ahead of time what are we signing up for? Great question, Doug. Thanks for
thanks Thanks for the question. So that is exactly what we are doing. We want to first start with what does the current state, what does your current plan look like? Because again, if you don't understand what you're currently doing and how you currently use the system, then how are you going to know that you need, maybe an alternative? You're just, getting your premium from the consumer side deducted from your paycheck, and then you move on with your life. And then if there is something that comes up, then you're faced with, whatever it is going to be, as far as the charge or the bill or, anything like that. So really we're trying to educate from both sides. So really saying, okay, here's what you have, to start with. Let's educate you on how these plans work so that you do know what you are involved in. But then we are going to educate on how we're different. How do we, offer different plans that really incentivize people to manage their health well, and take them on a care journey that says, you know here's where you started and here's where you can be, and we want to reward you for that by lowering your premiums. So that is something that is really important to us, not just saying, oh, here's what we offer, but really bridging the gap between that current state and what the future state looks like.
When we think about it from an employer perspective, and by the way, during the 2000s with the company I owned, ExecQuest Consulting, that was my insurance for my team was the number one overhead item. Like it was the most expensive item by far over my office space, over my database, over my computers, over all the fixed cost. That was incredible, part. And as a small or medium sized business owner, that's a challenge. Let me ask you this question: what are some questions that employers need to be asking to the insurance plan providers? What are some of the key things they need to evaluate as they look at the right plan for their employees? And I want to come back to putting the patient in the driver's seat, but I think this is a good point to talk about. What do employers need to be thinking about? Because they tend to choose everything on price, right? And what coverage they can get by with, et cetera. But what are some of the factors that they need to really think about when they choose a plan for their team?
Yeah, no, that's a great question. So, I would say there's a couple of things. First and foremost, really transparency. So, there's a lot of hidden fees, that are in existence whenever you're signing up for a plan with maybe your broker, or consultant like that. Really asking up front, what is this going to cost me? What is it going to cost me from your fees? What are you getting commissions on? Understanding their relationships with different vendors and things like that to really understand that the plan that you're going to be in is at least a year, maybe a longer contract. So you are investing some time, and energy into making this work for your employees. So you want to make sure that it's right. It's right for you from an employer standpoint. So you are getting the best, and most reasonable cost, as well as for your employees. So that's really important, is just understanding that transparency up front. And really just, from the employer standpoint, just figuring out how do you offer just a really comprehensive package. So who are the vendors that you need to work with, and who are the partners that you need to partner with to offer that comprehensive package? Because employees are wanting more. They're wanting different types of benefits. They're wanting, diversity. They're wanting a plan that actually meets their needs. Everybody wants to be seen as an individual. And a lot of times our plans today are a one size fits all. I have a couple of plan options, but really it's just a one size fits all. It's not looking at you as the individual. So understanding what is it that your employees are needing, and then building that into your plan. So, we always recommend doing, an employee survey of your employees before you even start the benefits process to understand your population. And it's going to change, over time as you hire and, terminate and things like that. You really need to have a good understanding of what your employees are seeking, and then build your plans out to meet their needs.
From a consumer perspective, we also, and this is always kind of been the case. I mean, obviously our workforce is made up of multiple generations. Now in today's workforce, arguably we have the most generations in the workforce at the same time. There's a lot of people that are in that baby boomer category that are still working. Obviously I fall into that category. I, I've always shared with is I'm very repetitive about it, but I may, from a calendar perspective, am a baby boomer, but Generation X is the one I identify as kind of like, I think that's more appropriate. But across the different generations and that are in the workforce, consumer demands and consumer interest are different. How do you help an organization address that? You were just talking about not having one size
Mm-hmm.
fit all plan, but talk a little bit about how it's not just, people that are in the reproductive age, right, or
Mm-hmm.
having babies or whatever, but it's far more complex. Consumer
Yeah.
practices and consumer choices are different, and how we make decisions are different. Talk a little bit about why
Mm-hmm.
that's important from a plan perspective to consider the needs of the individuals within your organization.
Yeah. Yeah, so really, getting a good understanding of what your employees are looking for is always, the most important thing to figure out, how are you going to build your plans. But like I said, there isn't a one size fits all. So you do have to assess and really determine what is going to motivate them. So we have a set standard of health management criteria that we, offer up to employers to say, hey, these are, best practices from NCQA, HEDIS standards, as well as from the Mayo Clinic. And we say, here's what we recommend that you offer as far as a program that will reward people for managing their health well. And then, we do recommend that that program be used to lower premiums because no matter who you are, what age you are, money back in your pocket is something that everyone can get behind. There is, definitely people that say, I'd rather have a gift card or I'd rather have that. And you can layer in different programs and things like that. We do offer different programs of excellence where, we might focus on a specific demographic, like, women's care or family planning, things like that, where you can kind of siphon out a few specific conditions where you can then reward accordingly. But really focusing on what is it that you're going to build out in your plan as your standard, and then rewarding people for that by giving them more money in their pocket for achieving those health outcomes.
You mentioned earlier that you when you're involved with educating consumers, you use TikTok, you use some of the all the different social media platforms. By the way, I realize now that um, one of the things that's very exciting is all generations are using those platforms in some form or
Hmm.
fashion now.
Yeah.
Before it was like the younger generation are using this and the older
Right.
generation not.
Yeah.
I was in a office not too long ago. My father-in-law at his daughter's appointment, and there were and it was an older patient population in the room, and five of the people in the room, I started paying attention, were using their phone
Hmm.
or on iPads or some form of technology. So I think
Yeah.
technology, everybody
Hmm.
started using. Not everybody's using it, but a lot of people. Let me
Right.
ask you this question: when we think about the messages that are going to the consumer on a broader scale, what are some of the messages that are not being clear, that are not clear? Where as an industry do we need to be better, do better about educating people, and because there's so much misinformation out
Hmm.
there. Like
Yeah.
if for example, if I have a symptom of an issue with my knee and I Google it, I can get
Right. You're
millions
dying.
of bad.
Yeah.
Yeah, I'm dying.
Right.
Yeah, I'm dying. I need amputation right now.
Yeah.
But what, as an industry, can we do to better help people understand what's factual? I like the transparency word you used
Hmm.
earlier, but I'd love for you to speak to that about from a because a lot of people watch my show. By the way, if you're watching this show, this is called the Healthcare Thought Leadership LinkedIn Live Show. It's my weekly show where I get to introduce you to people like Myranda and other people within my network. Um, Talk a little bit about that. Talk about how, as an industry, we need to do better
Hmm.
in terms of helping people understand their, and maybe even talk a little bit about what you do in that regard.
Yeah. So I think that For the most part, it's really just basing information off of factual sources. So I mentioned earlier NCQA and the Mayo Clinic. So, not pulling from the first, journal that pops up that may be looking at one side or the other, and, just needing to meet quota to get something out there. Really looking at your factual sources. So I'm a data person, and, I spend a lot of time making sure that I'm not just looking at the first, article that I read and taking that as the gospel, and really just looking at the sources. So going in deeper and figuring out, okay, where did this come from? What was the case study that actually, produced these results? Where, what credible organization is behind this? Really using that information to drive our content and what we're producing is really important to me, because I don't want to be, just another resource where people are like, this is the next best thing. This is the next fad diet. This is not, what we're promoting at all. We really want to pull together those best practices, the factual resources, to provide that education in a very simple and easy to consume way. Because, yeah, there is so much information out there, and you can read the first thing that comes up on Google and decide that that is your diagnosis, and that is what, it is what it is. So we do want to, stray away from that kind of thing and really just focus on what is the best practice. And I think that's kind of the main focus that we are doing as far as building out our content and making sure that it's actually meeting the needs of our consumers, whoever that might be.
One of the things that I recognize, and I'm as guilty as anyone, our attention spans have gotten
Yes.
smaller and smaller
Right.
and smaller. Like, uh, we have a kind of a saying in our families, like, uh, uh, the whole 48. Like, let's get all the detail that comes from the
Right.
show. The first 48 hours, like, there's so much to learn in the first 48 hours,
Yeah.
but you have to give it the whole time period. Like, you got to go deeper. I always tell people, every time you read an article or see a video or whatever, a news video or an article, don't just read the first paragraph
Hmm.
and by
Go with.
no means should you make a decision based on the title, because the title is most likely clickbait to begin with, right?
Right. Yeah.
But how, as consumers, can we do a better job of ourselves in terms of like learning and paying attention and going deeper? Like, what are some of the resources out there? Obviously, you work with companies on that regard, but
Hmm.
just on a more kind of micro level, as a healthcare consumer, where's it go? You mentioned Mayo Clinic, you mentioned some of
Hmm.
those other
Yeah.
resources. What are your thoughts on that?
Yeah, I think as consumers, yeah, we have the short attention span. We're trying to navigate so many things in our busy lives, and we're not, necessarily reading the journal of medicine to figure out what it is that we're trying to learn. So that's why, part of our strategy is to build out, take the really large information, boil it down to very small, simple, easy to understand concepts, so that we can cater to people who have a short attention span, which I'm guilty of as well. So, I want to really build that out so that the people that we're working with, really have something to resonate with as we're providing that content. But the other thing I would say is really asking questions, of your provider, of the clinical team that you're working with. I recently had an experience myself. I just gave birth to a baby about 8 months ago. And, I was amazed by the experience. I had some positive experiences, but a lot negative. And really, it was because I think, there's no coordination of care. There's no, I'm treated as an individual, and my baby's also treating as an individual. We're not treated as a unit. And, the doctors aren't talking, the nurses aren't talking, and it's no fault of them as an individual. It's really a fault of the system. And that's why, why when we get back to what are we trying to do and why are we trying to do it, it's because there are so many breakdowns in our system today that's supposed to be helping us, that's supposed to be for us and empowering us to, when you're at a point in your life where you're, giving birth for the first time, you don't know what you're doing. And you really do need the people there that are supporting you and that are, educating you. But if you don't have the right resources, or you don't know where to go, even as a very educated, health care system individual, there were still things that I was very concerned and, just not aware of. And I had to ask questions. So it's really just important as a consumer, no matter what period of life you're in, or what, if you have had diabetes for 10 years, you can still ask questions. If it doesn't, there's no beginner questions. And so ask your provider the questions. There's no dumb questions. And really just lean on those supported and factual resources, like your care team and like your, the resources that you can get with NuLight or other, credible resources, to really drive your decisions so that you are empowered, as a patient.
Uh, Great answer, and really on point. And I think it's something that all the majority of the people that watch healthcare thought leadership in my network are healthcare leaders at all levels, executives that run hospital systems, to large physician practices, to people in the private equity healthcare delivery space, a bunch of different pieces. That's my world. That's my network. And for those of you who don't know, that's the work that I do. I run an executive search firm and consulting firm in that space. But I think that what you just talked about is having an awareness for the patient around where to go find the resources, but also that why that experience can be a negative one. As leaders, we need to know that. And now that we're held to that standard as leaders, in where HCAP scores, where patient satisfaction surveys drive revenue management issues for us, that's so important. So as leaders, take note of that last answer, because I think that's really, really important. And for those of you watching, I posted in the comment sections a link to Myranda's LinkedIn page. Feel free to reach out and connect with her. If you're not connected with me, obviously, please send me a connect request. If you're interested in learning more about these shows that I do, and guests like Myranda, we're going to have, every time I have somebody on my show, I know we're going to run out of time. We have more to talk about. Myranda, we only have a couple more minutes left. We have about three and a half minutes left. Share with us, like, what is it? I know you talked a lot about what you're trying to do, and you've shared a lot about your company. But how are you going to measure how do you measure your success with your clients and with the industry? I'd love to hear about that.
Yeah.
Be a great way to close out the conversation.
Yeah, the number one way to measure success is by cost decreases, and really seeing the decrease in their total healthcare expenses that employees or employers are paying right now. We estimate that, working with us, using our model, you will save about 20 to 30% on your healthcare expenses overall, which is super important when, like you said, health insurance was the number one cost in your company. And for most people, it's the number one or number two cost after payroll. And so, if you are spending so much on your healthcare to provide for your employees, you should really know what is going into those fees, what is going into that plan, so that you are really providing the insurance, but really the plan that is needed by your employees. And every single population is different. There's not a one size fits all. We've talked about that earlier in this, discussion, but there's really, not a one size fits all plan design that is going to meet the needs of every single employer. So you do need to spend time and know what's going into those decisions and what is going into the plan, so that you can reward your employees for managing their health well. And so I think, yeah, measuring by cost is, it speaks for itself. The employer is being able to save money and spend that elsewhere, but also from the patient side, we're making it simple for them so that they can start to understand the healthcare system and use it in the best way possible. So, really finding those higher quality, providers that, they might cost more, but if they deliver better outcomes, that's fine. But we really want to drive that high quality care, and the network of people that we are working with is really important to deliver the outcomes that we have, outlined in our business model, and all the people that we work with. So really just would say, if you are looking to, lower your costs, or even just talk through your current plan and see if it's something that you want to, evaluate, schedule a call with us. We'd really love to talk with you and just see if it's a good fit, because that's what we do. We want to lower the cost of care. We are not just another insurance company or another broker or anything like that. We are really driven to, put the patient first and change the way that we are operating as a healthcare system.
Fantastic, and great way to wrap up. We're right at time. Thank you all for watching the show. Again, if you watch this live and you make comments, great. Thank you. If you watch it, the recording, which will stay, it'll be up on LinkedIn and it's evergreen. Please let us know in the comments. Gina checked in and said, great topic. Thank you. Thank you, Gina. Always pleasure to have you in the audience. And Gina is a great leader in her own right and healthcare executive in Georgia. Myranda, thanks for being on the show. I hope you have a great rest of your day. And we'll do it again later this spring when we talk a little bit more about the move to value-based care and that. So look forward to talking and have you back on the show.
Looking forward to it. Thank you.
Have a great day.
Thanks. Bye-bye.
Absolutely. Hold on.